Hello, everyone. Welcome to this webinar being hosted by the Civil Society Engagement Mechanism of the Universal Health Coverage 2030. This webinar is going to be on social participation. So in the interest of allowing as many people as possible to participate, we're just going to give a couple of minutes more for people to join in. If you have joined, it would be lovely to hear a little bit from you about yourself. So just your names, your organization, what you do in the space of UHC. And also it would be excellent to get one line perhaps from you as to why you joined this webinar today. What are you hoping to achieve out of this conversation and what we can do to continue to support you once this conversation is over. So with that, we'll just take a couple of minutes and then we'll kickstart the webinar. Right. So let's get things going. I think we've got a healthy contingent now. Just to say, to start things off, that this webinar is being recorded, and we're pleased to offer simultaneous interpretations in both French and Spanish today, as well as access to closed captioning. So most of our participants will be asked to select a language that they want to listen to, including the English speakers, but we will have a speaker in Spanish as well. So more on that when we get to that section. We have ample time for discussion as part of this webinar, so we're hoping to hear from you just as much as you hear from us. And we will try to give as many of you the floor and also respond to as many of the comments and questions from the audience as we can. As I said before, it would be lovely to hear from you, so please do say hello in the chat and let us know where you're joining from and why you're here. Please do try and familiarize yourself with the Zoom functionality and how you can ask your question and answers, but you're more than welcome to also pop them in the chat and we'll try and track them. So just to kick things off, I'd like to briefly discuss social participation, and we're very lucky to be joined by Laura Burley from WHO, who will talk about this in a bit more detail. But to give some context, the WHO essentially defines social participation as empowering people, communities, and civil society through inclusive participation in decision-making processes that affect health across the policy cycle and at all levels of the system. So this discussion is really about making sure that you who are working at the community level, working on ground in your countries, what is the best way for you to be involved and integrated into the decision-making that impacts you and your beneficiaries the most. On the subject, on the 29th of May, 2024, at the World Health Assembly, your countries endorsed a resolution on social participation for universal health coverage, health, and well-being. And this resolution is meant to ensure meaningful participation of people, communities, civil society, people with lived experience in the decision-making process, ensuring equitable and people-centered health systems to achieve universal health coverage and the Sustainable Development Goals by 2030. It's a major step forward in the implementation of the 2023 Political Declaration on Universal Health Coverage, in which world leaders committed to promoting participatory, inclusive approaches to health governance for universal health coverage, including by exploring modalities for enhancing a meaningful whole-of-society approach and, crucially, social participation. So in the lead up to the adoption of this resolution, your civil society engagement mechanism, as well as some crucial civil society partners, such as Sphere, the WHO Civil Society Commission, they mobilized civil society to build political support for this resolution. They co-developed some civil society priorities as well. They attended informal consultations led by the WHO and member states from your countries on the draft resolution. They co-organized webinars, developed a suite of advocacy materials as well, which were widely shared with this network of civil society partners, including yourselves. But the question now really is, what do we do to ensure countries implement the commitments they've made to advance social participation? And it goes without saying, you guys and civil society in particular has a critical role to play to drive the implementation of this resolution forward. So we're here not only to share with you a little bit about the resolution, to make you familiar with its content and what has been committed to by your government, but also to hear a little bit from you about what is our way forward. Only you know what works best in your respective countries and your context, and we wanted to be guided by your expertise on this subject. So with that in mind, I'm just going to briefly take you through the agenda for today's discussion. You can see it on your screen as well. We'll have a brief discussion on reflections on the WHA resolution on social participation. We'll follow that up with the social participation survey results, which Waiswa will be talking a bit more about later, but you will have been shared a survey to fill out to get some of your inputs on the social participation resolution and some of your ideas on the way forward. We'll have an interactive discussion around this same issue, trying to get your inputs on the subject matter. And then we have an excellent panel where we will have a very rich and informed discussion on how the social participation resolution has been moved forward in different countries and contexts, followed by a question and answer session where you can take advantage of the excellent panel that we've got at our disposal. So I'm just gonna kick things off with our first speaker, Laura Brearley, who is a consultant at the WHO. She's currently working as a consultant on social participation with the Health Systems Governance and Stewardship team at the World Health Organization. And she's going to be taking you through the reflections on the WHO resolution. Over to you, Laura.
Thanks so much, Ali, and nice to be here with you all. Thank you for the invitation. And you said a lot of it already, so I'll try and be brief and not duplicate too much. My presentation is a bit more kind of backward looking, I guess, to bring everybody onto the page of where we're at and how civil society, from our perspective, as well as all the things you've said, have contributed to the process. Can we go to the next slide, please? So this is a very messy slide. Some of you will have seen it before, and it's nice to see many familiar names in the group on the call. But it's to convey that it was a long process with various actions taken by different stakeholders at different levels to move towards this resolution. And so the role of civil society, as you mentioned, Ali, is pivotal in its implementation, but it was also pivotal in its conception. And so we've had the ideas of civil society coming to the DG about the importance of a resolution back in August 2021. There was an active role of civil society in the social participation technical network throughout the process of the development of the handbook, but then also in identifying a resolution as a key objective to move this agenda forwards. In the multi-stakeholder consultation for the technical paper, there was a huge amount of civil society input and rich content. In the side events that happened both the year before and the year of the adoption of the resolution, it was really key to demonstrate multi-stakeholder collaboration, that different voices were on the same page and calling for this resolution to happen and certain aspects to be strong within it. And then also in the formal, or they're called informals, but the formal member state negotiation process, there was this space for civil society to be consulted at 3 phases during the development and just following the adoption of the resolution. Next slide, please. As many will be familiar, there was a core group of 6 countries in the end that led the resolution process. Slovenia and Thailand were the co-chairs, with Brazil, France, Norway, and Tunisia. Next slide, please. It was a long process of negotiations between member states that ran from October right until May, really. But the initiative by the core group to engage civil society in this was not something that's standard or expected. It was really a great move, I think, by the member states who led this process in valuing and wanting civil society to be an active part of it, in so much as the WHO governance arrangements allow. And actually the WHO Civil Society Commission is doing a review of this initiative to document and learn from how civil society has influenced and been involved in resolution processes. The next slide, please. I've mentioned already these 2 side events, but there was a side event that was really important in 2023 at the 76th World Health Assembly, that was at which multi-stakeholder voices came together, including CSEM and others, to call for a resolution on this topic, and member states announced their intention to pursue it. And then again, this year there was the side event that really helped to demonstrate broadening and a swell of support really for this agenda. The next slide, please. So at the side event this year around the World Health Assembly, this EuroHealth special issue was launched, which brings together different voices. Civil society was very active in this. There's a perspective piece by civil society in it, and they also co-authored the piece about civil society capacities. So if you haven't seen it, please do. And I believe the links to various documents and processes I've mentioned will be in the chat box. The next slide, please. So the meat of the presentation is really the operational paragraph. So what does the resolution call for? Because that's what we need to return to explore how we move forwards with implementation. There were operational paragraphs specified for member states and for WHO. This is quite standard. There were not operational paragraphs specified for civil society. And that's not to say that civil society doesn't have a pivotal role in its implementation. So I think it's really exciting to see you all here gathered today and in other fora to put your heads together to think about, well, what is the role of civil society in moving this agenda forwards, and what can different stakeholders, including CSEM and others and ourselves, do to support you in doing so. But the operational paragraphs for member states, firstly, they were very clear, the member states who drafted the resolution, to frame it across health. You know, it was a cross-cutting governance agenda, not too narrow in focus. It was really about the modus operandi of health system governance, recognizing and addressing the social determinants of health as well, and making it clear that this is about sort of all decisions that affect people's health. The priorities that they outlined in the 7 points you can see on the slide are in line with those in the handbook and also the technical paper, and broadly cover strengthening public sector capacities, enabling equitable, diverse, and inclusive participation with particular focus on vulnerable and marginalized populations in vulnerable and marginalized situations, policy uptake of recommendations for participatory processes, so ensuring that those dialogues and the voices of people participating have some impact on the decisions that are made, implementing and sustaining regular range of mechanisms. So it's not an ad hoc event. It's something that really is happens at different levels of the systems and across the policy cycle in an ongoing way. Allocating adequate and sustainable public sector resources to social participation, capacity strengthening for civil society to meaningfully engage, and monitoring and evaluation and research to ensure that implementation is of decent quality and impact. The next slide, please. The operational paragraphs for the DG, the Director General, asks him to ensure WHO advocates on the importance of social participation, keeping it on the agenda and across the sector, developing technical products and operational tools, for example, work to strengthen metrics for social participation, the monitoring and evaluation work that has started already. And there's, for example, an e-course on social participation in the pipeline, technical assistance to countries on request, documenting and disseminating countries' experiences, and then facilitating this regular sharing and exchange, and harmonizing social participation work across the WHO, because of course this is a governance cross-cutting agenda, but it sort of is relevant for all areas of health and all parts of the system. So we see that at WHO, for example, different teams and different divisions have an interest in social participation in different ways. And one of the asks is for us to better promote coherence across the organization on this. And then, of course, to report back on progress. The last slide, please, is just a quick indication of some of the ways forward from our side. So many of those requests to WHO in the operational paragraphs require, I think, multi-stakeholder engagement. Some of those things are bilateral between WHO and member states, but many of them will be enriched and benefit from a multi-stakeholder process. And so we are keen to explore establishing some kind of a network for multi-stakeholder collaboration to advance implementation on the resolution. The core group is very keen on this and is actually now organized in a way where they're focusing on trying to conceptualize this network. They've expanded the membership, which is great, to include the Civil Society Engagement Mechanism, the WHO Youth Council, and the WHO Civil Society Commission, along with UHC 2030, and regional focal points on governance and social participation related agendas from WHO, as well as colleagues from headquarters. There will be potentially a meeting during the Thai National Health Assembly in November 2024. So Thailand is keen to open the doors of their National Health Assembly to invite other member states to come and explore and experience their National Health Assembly, and also to learn and exchange and interact with staff leading on the NHA's implementation, to enrich their experience, but also learn from each other. And there is potentially going to be a core group meeting along the sidelines of this, but it's yet to be confirmed. And the idea is that this network will hopefully launch early next year and help to bring different voices together to help drive implementation. I mean, the resolution is a really important step, but it's just the beginning, really. It's a piece of paper with a commitment. And now what we want to see is action and implementation at country level, for which we all need to collaborate and work together to make happen. And the idea is that this network could help to facilitate many of the, the collaborative aspects of many of the operational paragraph areas. So, for example, learning and exchange, advocacy where it makes sense to work together, often is the case, and consultations to inform technical products. I'll stop there and happy to answer anything if there was anything unclear. Thank you.
Thank you so much for that excellent overview, Lara. And really, as you said, it's a piece of paper, but it's a piece of paper with some powerful commitments that can really bring us closer to that idea of nothing about us without us, which is essentially what the social participation resolution is about. And you've mentioned some really excellent updates in terms of what's happening now. And we can see from that there's a lot of opportunities for civil society to also be heavily engaged with the process moving forward. And really, that's also what this webinar is about. One of our major objectives here is to hear from you, get your expert ideas on how we can move this resolution on social participation towards implementation at the national level, where it becomes more than just a piece of paper. So in preparation for this conversation, our excellent colleagues at the Civil Society Engagement Mechanism conducted a short survey from civil society and communities on immediate actions, priorities that government should take to implement the resolution, and what resources are needed for civil society to advocate with their governments. Around 20 plus responses were received, and our next speaker will share with us some of the top line results from the survey. And we hope to build on those today for further ideas on priorities for the government and what tools would be most useful to support your advocacy at the country level. With that, I have the pleasure of introducing my colleague and friend, Waiswa Nakwanga, who is the coordinator of the Civil Society Engagement Mechanism for UHC 2030. Over to you, Waiswa.
Thanks, Ali, and thanks everyone for joining us today. So we, in preparation for this webinar, we thought, we would do this survey, short survey, to get some ideas on what people think is the way forward on implementing the resolution social participation. And we wanted to use that, as Ali just explained, to kick off a conversation with you all, to get more feedback, to get more thoughts from your experiences working in your countries on what we can do together and also individually to move the resolution forward. So in the next few minutes, I'm going to share with you some of the results, really great feedback we received in this survey. The questions we asked were, the first one was, how can the resolution on social participation help improve decision-making for health in your country? The second question was, what immediate actions or priorities should your government take to drive the implementation of the resolution? And the third question was, what can civil society do to drive implementation of the resolution at the country level? The fourth question was about what resources do civil society need to support implementation at the country level? And then a fifth question around what structures already exist in your countries to ensure meaningful participation and engagement of communities and civil society in decision-making processes. Now, we received a lot of feedback, and so we really have pulled out just a few themes, and mostly common themes from all the responses we received. but there is more than what I'm going to share with you here. So we'll kick off with the first question on how can the resolution on social participation help improve decision-making for health in your countries. So here, and this answers a question that Oli asked earlier in the beginning of this webinar, which is, what can civil society do with this resolution? And really, the point of this resolution is to have some kind of reference point where we can all go and say, this is what my country, this is what our countries agreed to doing on this. And that gives us that authority to go and ask for action, to hold governments accountable. So this all came through the responses we received that, they see this as a reference document for all stakeholders, including communities and civil society, to demand action and to engage with governments and everybody that is involved to make sure that the resolution is implemented. It also, they say that it will enable a people-centered health service approach and equitable and resilient systems that will reach everyone, including vulnerable and marginalized communities in our societies. On the second question about what are the sort of like immediate actions and priorities that governments should, do to drive implementation, the respondents said that they need to organize consultations with civil society and communities to identify key gaps in the existing mechanisms and to address them together, and also to set up or strengthen governance structures to oversee the implementation at the country level. And this is really key because some structures might exist, but not strong enough to actually engage and ensure certain communities are reached. And so making sure that where they don't exist, they're set up, but also where they exist, that they're strengthened. And then that governments need to launch a national campaign to raise awareness about the resolution and the initiatives that they are putting in place to strengthen participation. And this is definitely going to apply to nearly every country, because if they have mechanisms already that are not strong, they need to be strengthened. If they don't have them, they really need to also raise awareness about what they need to put in place, they're going to put in place. On the third question around what can civil society do to drive implementation, there were across the board, people felt that we need to work in coalitions to pressure our governments to adopt and implement the commitments in the resolution, that we need to work with legislators and all decision makers to put in place laws and regulations and policies to ensure that the resolution is realized to support that implementation piece. And that we need to advocate, we need to raise awareness, to educate people about what their rights are in terms of working with their governments, working with their communities, speaking up on issues, representing their communities. So making sure that they understand that it's the right to do that, and also showing them some of the opportunities that exist for them to do that. So in some countries, we have processes that, are kind of happening annually or every certain period of time, so that they understand that those are happening and when and where, so that they can actually participate. That our respondents felt that we need to lobby governments for resources, and this was one of the operational paragraphs, that we need government to support social participation, to fund civil society and communities to be involved. It's not enough to set up structures and policies and laws if actually people don't have the means to access these spaces to be present. It could be transport, it could be food, it could be whatever it is that people need, the communities need, in order to be able to show up and provide useful feedback in the process. And then in that we need to ensure that social participation policies are incorporated into the national health strategies. Every country has some kind of national health strategy or plan, strategic plan. And so making sure that, this piece on social participation is fully incorporated in those plans, in those strategies, will be one way we can actually support the implementation of the resolution. Next slide, please. Great. And so on the question of what resources civil society will need to do this work at the country level, obviously, funding is really important. And this is not just a role for international actors, but also for governments to make sure that they are putting funds in to support participation in the systems they have set up, not just setting up a system where nobody will even participate, because some communities don't have the means to participate. So making sure that we have sufficient funds to support the participation, the training of people, the research that is needed, the mobilization that is needed is going to be key to us really being able to move this work forward. And then that there's need for, and this can be done by, government and donors and everybody, to build capacity at the country level to improve, strengthen technical knowledge on health systems and advocacy strategies, and training leaders. Training leaders that can help sustain this movement, because with that leadership, it's really very difficult to keep something forward. This is not something we're going to do for 1 year or two. It's going to have to happen over a long period of time. So making sure that we have leaders that can keep moving this work forward at the country level. And that we need to strengthen partnerships and collaboration among CSOs. This really was across the board. Everybody said we need this. Because without partnerships, it's really difficult to go alone and push a government to do anything. And so we really need that. And then that we need to support civil society to access the legal frameworks, to understand how the national health policies and regulatory frameworks work. This is really key to, figuring out, I was recently in Zambia, and we're talking about an issue in Zambia, and it turns out that it was the policymakers had made some legal stuff, but nobody understood it. And so we needed some expertise on explaining why things were not happening based on the legal framework that existed in the country. And so really making sure that we have that expertise and access. And then that we need to create tools for engagement, for mobilization to support that advocacy at the country level. And, we have a lot of tools now, especially digital tools like WhatsApp and others. We can create groups that can keep really raising issues, but also mobilizing advocates to engage. And that we need to strengthen the knowledge of the health system. So we all think we understand everything about health systems, but there's a lot that goes into health systems that we still don't quite understand. And so making sure that we strengthen that knowledge on different fronts, on healthcare delivery, on financing, on social protection, and others. So when we show up, we actually know what we're asking for and what we need governments to do. Next slide, please. Okay, so there was a lot of feedback received on this question about what structures already exist in your country to ensure meaningful participation and engagement of civil society and communities in decision-making processes. And we have to proceed with the assumption that there are some systems in some places. And this really was clear in the responses we received. Some countries have a lot, like for example, here on the screen, I won't read through everything, but for Tanzania, they have, this is not even a half of what they listed they have. And so systems do exist in some countries. The question is, do people know about them? How are they working? How are they really inclusive? What can be done to actually strengthen those systems, more so than whether or not we need brand new systems in the place. So it was encouraging to see that in many places systems actually exist. As Ali mentioned, we received responses from 20 individuals across 15 countries. So it's quite, it was quite diverse. From Costa Rica, also they say that health committees exist and that they engage various communities throughout the country. And so really the question there is going to be, what are they specifically? They didn't break it down, but how can then people engage in those processes? Do they really know? Do they need some support there? That's something that as advocates we can do in Brazil as well. And next slide, please. And we have also Nigeria. This is also like almost only half of what the respondents from Nigeria said exist in the country. And a lot that's happening that involves communities and civil society in that country. And so as we have more conversation today and later on, the question is going to be, where is the country and how do we make sure that we tailor our advocacy based on what exists in the country, not just abstractly, but what exists in the country. We do that analysis and then map out a plan of engagement based on the realities of the country. Where are the strong areas, where are the weak areas, where do we need to maybe establish something new? So that's a conversation that advocates at the country level will need to have in order to move this work forward in a very effective and successful way. I will stop there and back to you, Ali.
Thank you so much, Waiswa, and thanks for that excellent overview of the survey results. I think to directly address one of the questions that came through around the survey, how many people filled it out, and the representation, that's one of the points that we're trying to make here, is that the survey is still very much open, and it has been shared in the chat as well in English, French, and Spanish. We would love to hear from you and continue to hear from you, so do fill it out if you have the time. You can also scan the QR code that you see on your screen to get it open on your laptop or your phone. And we would love to hear specifically from you on all of the questions that Waiswa discussed in this survey. We're also getting some very interesting questions in the chat from a lot of very engaged participants. Thank you so much for that. Just to let you know that none of your questions are going to waste. We're collecting all of them and we'll be addressing them directly in the Q&As. But I did want to take this opportunity to ask a couple of the questions that have been raised, one of which sets us up really well for our next segment. And perhaps I'll put you on the spot for this, Waiswa. So Olya Golchenko from Frontline AIDS has asked, how can the resolution be practically useful to civil society in countries?
Yeah, and I kind of mentioned that really without a place to go and point to and say to government, this or the decision maker, this is what you've committed to doing, it's really difficult to hold leaders accountable to something. And so what this document does is that it gives us that platform to stand on, to go to our decision makers and demand action on all of those operational paragraphs that Laura so nicely walked us through. Making sure that we use it and say, hey, this is what our government signed up for to do, and this is what they agreed to do, and we would like to see action on this. And we can do that right now because it is a final document, it's what they signed. And so that's really a document by itself does not have much power. It is, you give it that power. And so own it, take it, use it, and demand action on this and hold people accountable. That's really, I don't know about other some of the other panelists, if you want to jump in here, if you have something else you would like to share on this.
Thank you so much for that answer, Raisva. I don't know, Lara, if you wanted to add anything. But if not, we can move on to just this one last question in this segment that I immediately got my eye. And it's from Kimberly Whipke, which is, there are countries that endorse the resolution, but at the same time are repressing civil society in their countries. Can the resolution be used as a tool to push back on closing spaces for civic participation, especially for stigmatized groups? I don't know, Asa, if you want to jump in.
Lara can go.
I'm happy to come in briefly. So just in terms of the first question, thanks so much. And yeah, I do think I think this is the beginning of a process to articulate how and what is the role of civil society. As I mentioned in the presentation, I think it lacks specifying it in the document itself. So it doesn't articulate the role of civil society in implementing this ambition. But I think the survey and this conversation already is starting to unpack some of what that's about. But I think that it would be very useful to, I think the entire purpose of the meeting today, I think, is to start to flesh out what is the role of civil society in taking this forwards at country level, and what can different stakeholders do to support them in doing so. So I don't think it's articulated as yet, but I think it's something that urgently should happen. And that is our ambition today, to start the conversation on it. In terms of civics, it's a very good question about the support of member states, and yet the reality of shrinking civic space and restrictions on certain populations' voice and so on. And I think this is a true reality of our world today, and perhaps becoming even worse rather than better in many contexts. But yes, I do think that this is a powerful tool, hopefully, to defend the importance of equitable, diverse, inclusive, participatory process, whereby having those words even in the resolution is powerful, because it is clear that we're talking about the voices of marginalized and vulnerable communities or populations in those settings. And I think, yes, hopefully it can be another tool to help to defend the importance of these voices and the importance of civic space. Civic space is, I think, mentioned in the preambular paragraphs, which I didn't go into, but if you take a look at the resolution more closely, I think there's also reference to the importance of the safe and enabling environment for participatory processes to happen, and safeguarding of that. So I think it's one of many tools that should help to defend this. I'm not sure it can make the change itself, but yes.
Thanks so much for that excellent contribution, Lara. And thank you so much, everyone, for the amazing questions that you're sending through. And I can see also that Lara and other panelists are already answering some of them in the chat. So that's excellent. We're firm believers in practicing what we preach. So this next section is going to be entirely about ensuring your participation and giving you a voice in this webinar and as part of these discussions. So I'm going to introduce my colleague, Laura Fildor, who is Advocacy and Communications Officer at the Civil Society Engagement Mechanism of the UHC 2030. And she's pulled together a very good Mentimeter that she'll be talking you through to lead us through the next discussion. Over to you, Laura.
Thank you so much, Ali, for this introduction, and for Lara and Waiswa for already leading such an interesting conversation. So as you were saying, we want to hear more from you, because we got some responses from the survey, but we really want to make space for you also to be able to let us know if there is any other responses you want to add, or any other thinking you want to share with us. So what we'll do is, I'm going to share right now a Mentimeter link that will be also in the chat. You can either click on the link in the chat, or scan with your phone the QR codes to go there. And what we will do is that we only have 2 questions, because we want to have more time for each question and make space for you to also speak about this. So we'll go over the question. We'll let 1 or 2 minutes for you to type your answer there. If you're facing any issue with the Mentimeter, you can also type your response in the chat. And then we'll open the floor for anyone who wants to speak. So if you want to raise a particular point, please raise your hands on the question asked, and we'll do that for the 2 questions. So yeah, I think that will be fine. So you have the link and then the Mentimeter, and I think you still have the instruction on the question. But if any issue, please feel free to let us know in the chat.
Thanks so much, Laura. And you'll be seeing the first question on your screen. It's a very interesting one. What specific activities would you undertake at the country level to ensure your government implements the resolution on social participation? If you could all take just a couple of minutes to log in and write out your answers. And if you have any issues at all, as Laura mentioned, just put your answers in the chat.
Thanks, Ellie. And that responds also to, some of the responses that was shared by VoiceWire in the survey. Some mention like needs for advocacy and implementation, so raise awareness towards government that this resolution has been adopted, or even through strengthening coalition of civil society groups to brainstorm on ways to move forward. Is it documenting country experience on social participation or gaps? Or are there any responses we might not have in head right now? So great, I see already 2 responses, Ali. 3.
We're just going to give it another minute, but I think we can do better than 3 responses. Oh, brilliant.
Thank you. We're seeing more and more responses with ensuring data collection, tracking of action. That's indeed like a key, one of the OPs that Lara mentioned on monitoring progress also. We have raising awareness in society at large. So not only to government for action, but also maybe for civil society in order to take ownership of this resolution too. Yes, we have also a very good one with booking appointment with the technical level technocrats. I'm sure, Ali, you see also many comments that are so relevant here.
Yeah, no, I'm seeing a lot around building coalitions, on engaging policymakers directly, being part of conversations involving technical working groups, all excellent suggestions. There's been a great point around making sure that we are meaningfully engaging people with lived experience and leaving no one behind during this process. So these are all excellent answers. I did wonder also if at this point there was anyone that wanted to quickly jump in and maybe give some of their reflections or comments on anything that stands out to them. Please do feel free to raise your hands, or if you prefer to do it through the chat function, that's also more than fine.
I saw that Ensure Health as their end rise. So I'm gonna give you the mic here. Please feel free to speak. Ensure Health, can you hear us? You might be also in old hands, so please anyone feel free to raise your hands. Or I know we have like several comments in the chats also that we can go through.
Brilliant. I think if there's no one that wants to jump in at this stage, it might be a good time perhaps for us to move on to our second question. And we're hoping that you'll be just as engaged as you were for this one, but thank you for your excellent answers. So our second question for you is, what resources do you need to advocate effectively with your governments? Please take a couple of minutes to answer this question. We're looking for essentially thoughts on advocacy tools. So toolkits, letter templates, anything that can help with the strengthening of your capacity for meaningful engagement, anything that comes to mind that would help with some of the very excellent suggestions that you've already given. We're already seeing some really good answers here. So people are definitely keen to get technical support from the WHO. It would be lovely to hear a little bit more from you on what kind of technical support you're looking for, but definitely the WHO will have a big role to play as part of this. There seems to be a demand for toolkits, but also access to decision-making platforms and also to experts that can help guide through the process. We're hearing a few very good answers around budget lines to make sure that there is enough to make space for civil society to be an official part of the process. Planning and reporting tools. These are all excellent answers and a lot for us to work with. Thank you so much. And we also have requests for a standardized workshop facilitation guide to review the resolution and the action plan. So to sum up, lots of requests for advocacy materials and tools, but we'd love to hear a bit now from you as well, just very quickly. I don't know if anyone would like to jump in and make some quick comments and reflections, and specifically just give some thoughts on what advocacy tools specifically would be most useful. I see Amrita has raised her hand. So Amrita, over to you.
Hello everyone. Hi Ali. Hi Laura. Hi Yolan. Everyone. Thank you so much. This is an excellent, session going on. Actually, I wanted to share some very the thought from the ground, actually from the community perspective, since this is universal health coverage, right? Now the high time at many places at national level, regionally, globally, we are seeing that there's a time that community people have to put first, right? So people who are from the marginalized community, they can raise their voice, they can articulate their needs, challenges. I think they are the best people, right? So I was just thinking that there are two issues actually. If you can address, maybe not now, maybe sometime later. One thing is that definitely HIV money is shrinking, that I already mentioned in the chat box. There are countries like India where there are like FCRA rules and these things, and things are getting more rigid day by days. So there's a question of funding in terms of domestic and international both. That is one. Number two, my concern is that in such platform where I can see this, for example, any international platform talking about SDG, talking about USC or any UN level, there I think we have to prioritize the community needs. Yes, there are like high level expert on different topics, doctors, scientists, absolutely fine. But please give some spaces who are actually facing the problem at the ground level. So as a collective, as with supporting frontliners, we have different partner organizations. Can we think about something that we can stronger our voice in all these platforms if possible? Thanks a lot.
Thank you so much. That's an excellent intervention and such an important point made, absolutely. And something for us to reflect on as well as the civil society engagement mechanism. Can we help develop some tools that can specifically address this point that you've raised? We have a lot more hands up I'm seeing, but we're also a bit short on time. I wonder if we can take maybe one last participant and give them the floor. Laura, I don't know, you're better placed to see who it is who's raised their
Sure.
hands.
Sure. I see Flavia who raised her hand second, so I just asked you to unmute, so please feel free to speak up.
Thank you, Laura and Ali, for the great presentations and also guiding us through the Zoom, the webinar. Now, for me, the advocacy tools that I would think of is things like how to do training manuals on advocacy for implementation, adaptation of the resolution, but also how to develop position papers, how to do petitions, how to do policy briefs, press statements, because these are very important for CSOs to use and push. But also, we need to do budget advocacy. Do we have information on how we can do budget analysis, budget monitoring and tracking? Because talking about the policies without looking at the budgetary allocations and ensuring that communities are able to participate and be represented in these processes, from community to district, okay, to national and subnational levels, communities and CSOs must be represented in budgeting, in policy development, but also ensuring that integration, and also to making sure that UHC works for communities and also stems from communities, because now we are looking at the family and community-centered approaches to health. And so for me, those are the few things: budget, health financing, advocacy, and all the tenets, and then also policy advocacy and all it takes, but also research skills. How do we do research that is informative every other time to see how much, but also we can do regular shadow reporting about how countries are implementing. Sorry, I'm in a noisy place, but shadow reporting to ensure that we have like 2 years or 3 years, you are reporting on the achievements or the progress the countries have done. But also adaptation, how do we participate in adaptation of this resolution in the policy process? So the tools that we need, I have enumerated. So over to you. Thank you, Laura and Ali, and let's keep the discussion moving. Thank you.
Thank you so much, Flavia. And that is such a helpful intervention. And it really gives a very clear kind of pathway in terms of next steps of the kind of tools that can be developed to help civil society. So brilliant from you, brilliant as well from Amrita, in terms of making sure to remind us that we can't leave our key populations behind as part of these discussions. And I have time for just one last question, and I hope I'm pronouncing the name right, but Sawad, I think you had your hand raised. I wondered if you'd like to just quickly, in a couple of minutes, jump in and give your thoughts.
Oui, merci beaucoup. Merci Laura, merci Ali. Juste moi, je voulais soulever le problème de fait parce qu'on a une catégorie de femmes qui sont vraiment dans une situation vulnérable, c'est le secteur de l'agriculture. Et ces femmes, elles sont dépourvues de toute protection de santé et d'autres protections qui leur incombent. Mais le problème, c'est que par rapport à ce que vous posez, c'est extraordinaire parce que nous, on ne cesse de faire la sensibilisation, on ne cesse de voir le nombre de ces femmes-là dans toute la région. Elles représentent plus qu'on a 30% de la main-d'œuvre agricole en Tunisie. Et comme le secteur agricole, comme vous le savez, dans les pays en voie de développement, c'est un secteur qui est informel. Et du coup, ce n'est pas l'État qui incombe par rapport à tout ce qui est protection sociale et principalement tout ce qui est protection sanitaire. Et c'est un gros problème vu que le secteur, il incombe beaucoup de risques, principalement pour les femmes avec les pesticides, avec tous les différentes autres composantes. Et moi, je veux bien, dans la boîte à outils, retrouver ces quelques outils où je peux utiliser avec ces femmes, parce que presque chaque semaine, nous, comme Marche mondiale des femmes, comme coordination, avec d'autres organisations de la société civile, on est en train de faire la sensibilisation et de faire des plaidoyers, sauf qu'on en manque par rapport à tout ce qui est budget, parce que même ici, il n'y a plus de budget. Donc, c'est pour cette raison que ça serait très extraordinaire si on peut en avoir à travers cette résolution quelques outils, quelques boîtes d'outils pour nous fonder par rapport à notre plaidoyer. Et merci.
Merci beaucoup, Souad. Je vais continuer aussi en français pour nos amis francophones sur la conversation. J'espère que vous suivez bien pour les amis anglophones et espagnols sur les chaînes appropriées. Merci beaucoup, Souad. C'est un très bon commentaire sur comment faire en sorte que tout le monde soit inclus et notamment les femmes et aussi dans le milieu de l'agriculture. Et je crois que c'est un des points principaux aussi dans cette résolution-là, c'est de faire en sorte que les populations les plus marginalisées soient inclus ici. Et c'est pas toujours facile, ça dépend beaucoup du contexte du pays. Donc, merci pour tout ce que vous faites déjà en ce moment en Tunisie. Et c'est très utile d'avoir votre retour d'expérience. Merci, Souad. I now will give back to Ali, but I think we will have now to close the questions so far. But please feel free to add any more question in the chat. We'll try to take some time to respond to it. But I think it's a good transition to the panel discussion.
Absolutely. Thank you so much for that intervention, Laura, and for that excellent set of questions, comments, and your contributions to the Mentimeter. We're going to urge you to go back to the survey that was shared with you, and please do find some time after the webinar to give in your responses and let us hear from you on what you think is the most important set of tools that we can develop to help you do your work better at the national level. We are now going to transition to a very exciting segments where we will be hearing from some of our amazing panelists who have looked very closely at social participation and on particularly some of the best practices and lessons learned in different countries and contexts on what meaningful engagement and inclusion looks like. We're hoping that these lessons will be helpful for all of us as we look to ramp up our advocacy at the country level. And crucially, we've got some amazing minds in the room, and we'll have about 15 to 20 minutes at the end for you to pick their brains and ask some questions on what you can be doing at the country level from the lessons that have been learned by them. So with that, I'm going to introduce with great pleasure our first panelist, Courtney Howe, who is the project lead at Inclusive Global Health Institutions Project. She's an advocacy manager at Stop AIDS as well. Courtney, over to you. We have basically in last October, Stop AIDS launched the Principles of Meaningful Involvement of Communities and Civil Society in Global Health Governance, drawing on years of established practice. In that exercise, Courtney, what were the top 2 to 3 best practices that you identified for ensuring meaningful engagement of civil society?
Thanks so much, Ali, and hi, everyone. Yeah, as you just said, Ali, these principles launched in October of last year. They were co-developed and are endorsed by the community and civil society delegations and UNITAID, Gavi, Pandemic Fund, Stop TB Partnership, UNAIDS, and the Global Financing Facility. And their aim is to improve the meaningful inclusion and involvement of communities and civil society in global governance and decision-making processes, and to provide that benchmark for institutions to work towards and to be held accountable for. And I appreciate they are sort of aimed at global health institutions, but I think there are a number of pieces that we've learned in that process which can be discussed here in the context of social participation at a national level. I think, first of all, obviously, they are informed by broader meaningful inclusion policies and approaches. And I think also there's a key link following the resolution that needs to be explored that looks at, as we increase social participation at a national level, how can we also ensure that there's that link to the global level processes as well? And picking up on Kimberly's point in the chat around shrinking civic space, that's definitely something we see at the global level. And so how can this resolution also ensure that when member states are in these sort of international negotiation spaces, for example, at the global level, that social participation means that they are representative of community kind of key priorities. The 5 principles are shown here on the screen. And as I said, I appreciate they are very much focused on sort of global governance, but I think some of the sort of best practice and key pieces that I want to highlight are, in the first principle, for example, we talk about communities and civil society. And that is sort of a very intentional piece here because we want to recognize and support the distinct perspective that communities bring. So in the context of decision-making and governance structures, this means having a specific seat space for communities to be represented alongside NGOs. And I think that is something that can apply not only to boards and governance structures, but more broadly in these spaces, recognizing that critical importance of community voices and priorities. We talk about it being a permanent role. And again, the importance of having this as a sustainable engagement that really allows communities and civil society to conduct long-term planning and advocacy to really maximize their impact from a social participation perspective, rather than only being sort of afforded ad hoc opportunities to engage. And the third piece of that one around voting, and I appreciate again, that's very specific to sort of formal governance structures, but it does highlight the need for, member states talk in the resolution around the need to ensure that social participation influences transparent decision makings. And whilst it might not be a voting structure, it is going to be critical that communities and civil society have a fair ability to influence decision-making processes, and it's clearly communicated how their input in processes feeds into those decisions, and that there is that kind of feedback mechanism back. I won't go through all of them. I think, principle 3, I think funding, I saw in the Mentimeter, we talk a lot around the critical importance of funding communities and civil society more broadly. I think also when we are asking communities or civil societies to represent their broader networks and spaces, I think it's really important to highlight the critical need for funding specifically for those kind of representative roles, recognizing that often there's a small number of individuals who are there to represent much broader networks. And that takes a lot of time and effort to ensure that they're truly representative of that group. And so the critical importance of not only funding civil society and communities, but also specifically for these sort of representative spaces as well. And I think the last piece that I'll highlight is the final principle. So the first 4 principles that are here are very much focused on how institutions and their governance structures can be more open and accessible, and the kind of pieces that need to be in place for that to happen. And then the next piece of that, which is the last principle, is around as civil society and communities as well, how we organize ourselves as well. So as we aim towards these kind of more inclusive spaces, how can we also hold ourselves to account? As I said, so often in these spaces, there's a small group who are representing much broader networks. So how can we ensure that there is information sharing, there are opportunities for our networks to input the kind of positions and the information that is shared, and also how do we support each other so that there's a continual learning process, and for example, youth programs as well, to allow broader community and civil society colleagues to participate in these processes. Thanks.
Thank you so much for that excellent presentation, Courtney. I'm going to transition us over quickly to Camila Serrao from Fundación Huésped. She is part of the implementation research team there, and she has done a lot of excellent research on key projects related to universal health coverage, and particularly on cancer prevention for people living with HIV, transgender individuals, and sex workers as well. Camila will be presenting in Spanish, so to be able to hear her presentation in English, do kindly click on the English under the little globe that says interpreters at the bottom of your screen. For those who want to listen in French, please, you can continue to stay on the French channel. With that, I wanted to speak a little bit about your research, Camila. So Fundación Huésped and Sphere have done research on strategies for meaningful and inclusive social participation for health in Argentina. Could you share with us very quickly some of the key findings of that study?
Bueno, buenos días, muchísimas gracias por la invitación. Desde Fundación Huésped estamos trabajando en conjunto con SDGs desde el año 2023 en dos proyectos. Uno de ellos tiene por objetivo recabar y documentar a partir de seminarios testimoniales experiencias de participación social en Argentina, específicamente de comunidad transgénero y de trabajadoras sexuales. Y además estamos haciendo en conjunto una revisión realista con Letigiari. Esta revisión tiene por objetivo identificar los procesos de participación social, analizar los mecanismos de inclusión, los contextos en los que se lleva a cabo y analizar los resultados de estas políticas. Como en otros métodos de síntesis de la evidencia, realizamos una búsqueda exhaustiva en distintas bases de datos y recabamos 18.600 artículos a partir de distintos métodos de elegibilidad, de pertinencia, de calidad y de inclusión. Seleccionamos 178 que, como pueden ver en la imagen, tenemos experiencias de todo el mundo, tenemos una gran cantidad de experiencias de África, de Asia y en menor medida de América Latina y el Caribe. Elegimos 3 pequeñas experiencias que reflejan algunos de los aspectos de participación social de Latinoamérica y el Caribe, específicamente de Colombia, Brasil y Argentina. Si podemos pasar a la siguiente diapositiva. Estas 3 experiencias tienen en común que buscan promover la participación social. En los casos de Brasil y de Colombia, son experiencias que surgen de reformas constitucionales o de reformas de los sistemas de salud. En el caso argentino, por otro lado, es un abordaje sociocomunitario de consumo problemático de sustancias que surge a partir de distintas organizaciones. En el caso de Brasil es la implementación de consejos de salud, que ya se mencionaron anteriormente en el webinar. Estos consejos surgen a partir de una reforma constitucional a finales de los años 80. Funcionan en todos los niveles de salud, hay consejos en el nivel federal, en el nivel estatal y en el nivel municipal, y tienen funciones deliberativas, consultivas y de monitoreo. La elección de los representantes que participan en estos consejos se da de manera heterogénea, pero siempre se parte desde el principio de paridad y todos los sectores deben estar representados. En el caso del Consejo Nacional de Salud, está conformado en un 50% por organizaciones de la sociedad civil, organizaciones de usuarios, un 25% por proveedores de salud, tanto estatales como privados, y un 25% por profesionales de la salud. En el segundo caso, el caso de Colombia, esto se da a partir de una reforma del sistema de salud que busca ampliar el alcance de la atención primaria a partir de la creación de microterritorios. Estos microterritorios corresponden a zonas periféricas y se le asigna a cada grupo motor un microterritorio en el que va a trabajar. Estos grupos motores multidisciplinarios están compuestos por médicos, por enfermeros, por miembros de la comunidad y también por promotores de salud. Estos promotores de salud tienen vínculo con líderes comunitarios para generar espacios de asambleas y de comités que puedan establecer las prioridades, diseñar y ejecutar las estrategias de ampliación de estas reformas. Por último, el caso argentino es un caso de abordaje comunitario de consumo problemático de sustancias que surge en respuesta al abordaje biomédico y que busca reducir los daños del consumo. Son dispositivos totalmente comunitarios que se establecen a partir de 2 grandes estrategias. Por un lado, el empoderamiento de los líderes comunitarios que son o fueron consumidores de sustancias, y por otro lado, la generación de redes en distintos niveles, redes a nivel familiar, entre pares y de organizaciones que puedan sostener estos dispositivos. El principal reclamo es el pedido de apoyo de las autoridades locales a estos dispositivos. Algunas de las barreras que relevamos en los artículos que incluimos es que algunas opiniones mencionan que en el caso de Brasil, algunos de los grupos más excluidos no tienen participación en estos consejos por no poseer el mismo grado de organización que otro tipo de espacios como los sindicatos. En el caso de Colombia, que hay cierta instrumentalización de la participación comunitaria, que no permite el verdadero empoderamiento de las comunidades, y en el caso de Argentina, principalmente la falta de financiamiento para poder continuar con estas experiencias. En los 3 casos y en muchos de los casos que estuvimos relevando, encontramos que es fundamental la voluntad política de los gobiernos, de las autoridades, para poder no solo financiar, sino crear y sostener en el tiempo este tipo de experiencias. Y nos parecía que estos eran algunos puntos clave que podíamos traer para aportar a la discusión de la implementación de políticas que apunten hacia la participación social y hacia políticas que sean más inclusivas. Por último, en la última diapositiva, está todo el equipo que venimos trabajando, algunas de las personas del equipo que venimos trabajando en esta revisión, el equipo de Argentina, la Fundación Huésped y el equipo de The George Institute. Así que bueno, espero que aporte a la discusión. Muchísimas gracias.
Thank you so much for that amazing presentation, Camilla, and for that amazing comparative analysis of the three countries and how social participation has been implemented there. I'm going to move us forward as we continue our discussion on best practices and lessons learned around social participation to go towards Tikala Itaye, who is the lead on health and community systems advocacy at Frontline AIDS. She's also a human rights lawyer and a global health advocate. My question to you, Tikala, is to know what can be done to implement this resolution, we need to understand the landscape of social participation and inclusion, meaning the current situation, the gaps at the national level, regional level, and the global level. A first step to this is to undertake a study in a few countries, and that's exactly what you've done. So I wondered, what have the assessments of these existing structures for social participation in the selected countries that you looked into revealed so far?
Thanks, Ali. And just to mention that the work that Frontline AIDS is doing, and for those who just don't know Frontline AIDS, we're doing a lot of work in supporting our partners across 100 countries who are working in the HIV and AIDS response. And we embarked on a research project this year. And what I'm sharing is pretty much preliminary findings to kind of evoke more discussion. But we are currently in the process of putting together a report that's looking at key issues around integration of the community response in national health plans within UHC. And one of the components we were looking at was around how meaningful participation and inclusion looks like in 5 key countries: India, Botswana, Cambodia, Ecuador, and Lebanon. And it's great to see some of our partners on this call as well from Ecuador, Christian, and Amrita from India. So I'm sure they'll be able to jump in on the discussion section to add more. And also Olia, who's just come back from maternity leave, who actually covers this role that I have as the lead for advocacy for health and community health advocacy. So I see she already had thrown in a lot of questions for us to look into. So yeah, back to some of the work Frontline AIDS is doing. So from the preliminary findings in these key countries, we have noticed that the HIV community response system, there's been a lot of learning that's come out. I think a lot of you are aware that Global Fund has played a key role in actually pushing a lot of social participation and inclusion at country level, especially when it comes to key populations that are affected on issues related to HIV and AIDS. So when we had from our survey, that our consultant was leading on, they found that in all these countries, especially countries that were receiving Global Fund funding, there was meaningful participation of people living with HIV, LGBTIQ plus communities, adolescent girls and young women, and sex workers from government-led technical working groups and technical resource groups that are related to HIV and AIDS. But a lot of that influence obviously came from key community HIV response models that have been there and that are being funded by Global Fund. So you could actually see the reason behind the meaningful participation because of those set mechanisms that are being put in place. I think a lot of learning also that has come out from this kind of key commonalities that came out from these countries is also the CCMs, right? Because coordinating country mechanisms under the Global Fund are really intentional of having this representation and decision making around the Global Fund resources that are coming in country, where you also have key government stakeholders on those CCMs. So yeah, so that kind of speaks to kind of the commonalities and representation, which is mainly influenced by Global Fund funding, but also government-led national AIDS commissions for other countries, national AIDS coordinating mechanisms or agencies. Some of the common gaps in representation decision-making structures that were coming out from some of these countries from the preliminary findings is that most of them really were sharing that there is underrepresentation of youth in technical working groups. And I think this is really critical because recognizing that a lot of our countries' majority population are youth that are hugely affected by some of these health issues. And you're not seeing much representation of youth in these key decision-making committees. Another key area that was also brought up is to say that you're still kind of seeing a lack of participation for marginalized communities, especially rural population, indigenous groups, people living with disabilities. And I think this kind of speaks to what Camila was also sharing on some of her, the country assessments they have, that a lot of these informal groups, maybe rural populations or indigenous groups, in some countries, not all, because obviously contexts are different, that kind of recognition for people to represent on key decision-making committees. A lot of governments look at how organized is this group? Are they registered? For them to kind of handpick and identify who's going to represent on technical working groups. So I think that's also an element that others were sharing when there was discussions happening around the marginalized communities that are being listed in. But I think the issue also of intentionality of ensuring that these groups are there. There isn't a particular guideline that kind of checks to ensure that there is wider representation of marginalized groups from these key areas and communities who face significant barriers when it comes to healthcare access, and who already have a seat on the table when it comes to decisions being made. Another key thing that came out on the gaps was just the disconnect between national and subnational level. I think we can all recognize that these different multi-level governance structures in a lot of the different countries, especially even the ones that we've been looking at. And from the preliminary findings, there was mention to say that you are seeing meaningful participation at national level and health decision-making committees at national level, but sometimes that's not really translated in regional or local decision-making structures. In some countries, yes, but in others not. So I think this is different in different contexts as well. But I think for us to really recognize that when we are talking about meaningful participation and inclusion, we really need to be looking at how that looks like at the different multi-level governance structures. Yeah, and just to kind of close off, because I also want to leave room for discussions and to leave room for some of our partners that have been really speaking into this issue at country level and been working closely, even in the CCMs at country level, to have time to share. But I really wanted us to use this opportunity to kind of consider key areas when we're talking about social participation and inclusion, and areas we're further exploring from frontline aides is just the level of participation, right? And this speaks to the levels of participation different communities are participating. If we have representation at national level, is this reflective at the other regional and local level? And this is something we need to be looking at. And are they speaking to each other in terms of whatever decisions are being made at local level, are they being reflected at national level? Or whatever decisions are being made at national level, are they being reflected at regional and local level? And I think those are processes that we need to be thinking about and influencing as well. Another key thing is the decision-making process of points of influence. You find that from even our preliminary findings that most involvement of key community organizations working in HIV will probably be invited to maybe certain level of decision-making. Maybe it could be a consultation on developing a health plan or informing. But when it comes to monitoring and evaluation of a particular strategy, there's gaps in representation and decision making when it comes to allocation of resources on where they will go for responding to key health issues. Not all civil society or community voices are part of that decision making process. So I think having to also critically look at the points of influence in decision making processes is really critical to ensure that in all points of influence, community voices and representation is there. And
Thanks.
lastly, also having to consider how often committees meet, right? Really critical for us to kind of think about that in each country, there's different times committees are meeting, and at those different points that they're meeting, are we ensuring that the different voices are being represented as well? I'm sorry, I know there's time's up, so I'll end off there to ensure that there's time for discussion. Thanks.
Thanks so much, Takala. That's an excellent contribution that you've made. We are almost at time, but very quickly, I'm going to transition on to our next speaker. So we've discussed some best practices on civil society participation. We've talked about strategies on meaningful social participation, talked about gaps in social participation and inclusion. And it's my pleasure to introduce last, but certainly not least, Danny Motzi, who is the CEO of the International Alliance of Patient Organizations, IAPO. Danny, I have a couple of quick questions to ask you. And these are that today is, if we're not mistaken, today is World Patient Safety Day. And we would love to hear from you a little bit to come talk about the importance of involving patients in health decision-making. So why is engaging patients and family a pivotal strategy to advance safety in healthcare? And my second question will very quickly just be around the work that you're doing on developing the UHC Compass, which as I understand, is a tool designed to help patient leaders at national level work effectively on UHC advocacy based on the needs and gaps expressed by the community. So what can you really share with us about this tool, and how can the advocates on this webinar use it for their work? Over to you.
Thank you, Ali. And hello, everyone. I'm thrilled to bring the patients and the patient organizations' perspectives into this debate on social participation in health, and also to be co-hosting this webinar with SESAM and Frontline Aids. So you know a little bit about IAPO. We are a pioneer alliance representing nearly 300 patient organizations across all disease areas from all regions of the world. And we were established 25 years ago to collaborate on common agendas for the patient organization community and address challenges transcending national borders. But it's also important to highlight that we are a non-state actor in official relations with the WHO. And because of that, we have been engaging many of the discussions, not only regarding social participation, but also patient safety. It's a big agenda for us as well, considering that today is the World Patient Safety Day. So given their lived experiences, the patients and patient organizations can play a key role in shaping health systems to ensure that they are responsive to the unique needs and preferences of the people and communities they represent. And people with lived experience should be recognized as essential stakeholders, not only in decisions that directly impact their lives, but as the resolution well states, in decision-making processes that affect health across the whole policy cycle and at all levels of the health system. IAPO has been leading and collaborating on different initiatives to leverage the role of patient organizations in helping translate the resolution into meaningful action. And today I would like to talk about two of those initiatives, the UHC Compass that Ali mentioned, but also the Global Patient Movement Catalyst. And one thing that I'm very happy to hear is that the results of the survey that was shared before this webinar, they align so well with these two initiatives that I'm going to present right now. And it just reinforces the need to hear what civil society is saying and asking to be able to do the work that they need to do on the ground. So starting with the UHC Compass, as Ali mentioned, it's interactive tool that aims to support patient communities around the world to advance UHC on the ground. This was a tool co-created by what we call the Global Patient Think Tank. It's a group of patient community representatives from all over the world, and I'm very proud to be part of this group. We were convened in 2023 by Roche, and the main goal was to integrate the patient community perspective and voice into the UHC movement. So the UHC Compass has been developed in the past year, and now it's being pressure tested by patient organizations on the ground because we are about to launch it this year. And I'm thrilled to share that IAPL will host the UHC Compass. And on behalf of the entire GPTT group, I invite you all to stay tuned for more news about the launch. And what's unique about the UHC Compass is that it provides not only the knowledge on UHC, but also it goes beyond. It offers self-assessment tools and also opportunities for patient organizations to develop their capabilities to advance UHC locally. And it's a tool that was built upon the resolution on social participation, but other very important existing UHC resources, such as the Health for All Advocacy Toolkit developed by CESEM. The Compass has 4 modules, and the first one is the introduction on UHC, what it means, and what it means to patient organizations. The second one is the first self-assessment section, and that is to help patient communities connect the work that they're already doing, but also their priorities to their local national UHC setting. The third module of the Compass is the second self-assessment section. And this time is to help the patient communities to understand their readiness level to engage in UHC. So first, they understand what are the priorities connected to UHC, and then understand what's their readiness level to engage with UHC. And module 4 of the Compass is to guide these patient communities by building and enhancing their capabilities, but also it draws on good practice examples from the patient community from all over the world. And I hope that with this short and brief description, you can see how the UHC Compass was created by patients for patients. And it's supposed to, we're expecting it to be a living tool that will continue to evolve and improve with the use and support patients to play an active role in shaping universal health coverage on the ground. Very quickly, another important initiative that IAPL is part of, it's the Global Patient Movement Catalyst, which is a group of patient representatives, experts of lived experience, and patient engagement champions. And we are all co-crafting real and actionable strategies to help the patient community to collaborate more and achieve more together, and achieve more efficiently, more effectively, and more sustainably. The patient movement catalyst is based on the principle that patient organizations need to be equipped to act with full operational agency, and involves 3 key elements. One is positioning and embedding patient organizations in global health systems decision-making structures. So very linked to what we have been discussing with regards to the resolution. The other element is offering capacity building that will facilitate decision-making. And finally, building and reinforcing greater financial diversification, autonomy, and independence through more
Thanks so much,
innovative
Danny.
funding. So just to conclude, this resolution is a key opportunity for patient organizations, for the patient organization community to showcase the true value that they can bring to health systems. And I just want to reinforce how our community is making significant strides in uniting and advancing efforts to co-create solutions at different levels to support social participation. And it's a great honor to be part of all of this together with CESEM and Frontline AIDS. We are committed to continue supporting everyone in this pathway. Thank you, Ali.
Thanks so much, Danny. That was an excellent presentation from Danny just now, and it sets us up really well. We're at time. Thank you so much for your patience, everybody. We're going to take one quick question out of the many interesting ones that have come in the chat, and then I'll hand it over to my colleague Waiswa to close out the webinar. So the question that we had was a very interesting one, and it started with you giving an example from Kenya, speaking about how there was a challenge, a constitutional challenge to legislation purely on account of the fact that there was not significant amounts of public participation. So the question that he's asked, and we've already discussed in quite a lot of detail the role civil society must play in social participation, but I wondered if any of our panelists wanted to discuss the role the media can play in ensuring implementation of the social participation resolution at the national level. Floor is open to any of our panelists that want to answer this.
Well, I can jump in there. I mean, the media has a key role to play, and we should engage them. It is a way it's a means that we can utilize, a tool we can utilize to bring our issues to the public, and sometimes to get a response, to force a response from the decision makers about an issue. And so definitely a tool, I see it as a tool, a very useful tool for advocates to leverage in making sure that we not only make our demands heard by decision makers, but also they will hold them accountable when we need to. The media is a little bit of a double-edged sword. You have to be careful when you're dealing with decision makers, where if we put them in the media, they might take it as you trying to embarrass them or to attack them. And so, and yet we want to maintain really cordial relationships with decision makers so they can do what we need them to do. And so really being very careful about that. But also it's a tool that we can use to share our research, to share our findings, to share our thinking about an issue on social participation. And so something that is really key to us making the kind of difference we want to make at the country level, I would say.
Thanks so much for that intervention, Waiswa. And it's so on point. We have to be very strategic in how we manage our relationships with our policymakers, because the whole point is to become part of the dialogues and conversations with them. But there are a lot of excellent ways in which we can engage the media as part of this process. I'm going to close today's webinar by handing back to Waiswa just to talk us through some of the existing advocacy resources and some of the opportunities to come moving forward. Back to you, Waiswa.
Yeah, and I want to thank everyone for staying with us this hour and a half. Really excellent discussion, excellent questions, and I wish we had more time to answer all of the questions, but there will be more of these conversations that we're going to have follow-ups. And so stay tuned. We will be in touch, and we have more conversation and hopefully answer some of the questions that didn't get answered today. I want to share with you one really important opportunity in terms of mobilizing for social participation for UHC. And that opportunity is the International Universal Health Coverage Day that happens every December 12th of the year. And this year's campaign has already started, although the official launch is going to be on October 3rd. And we would love to see you, to have you in this conversation about how we achieve financial protection for millions, billions of people around the world that are can't access health services because of financial barriers, or that are pushed into poverty because of financial barriers in accessing health. That's the focus of this year's campaign, but we are launching it officially on October 3rd, and I would like for you to join us at the launch. And I think it's a very important opportunity for us to continue to mobilize around social participation for the next 3 to 4 months. I think that's it. Laura, if you have anything else or someone else to share. Otherwise, we'll close. We do have some resources that we're going to share with you in the follow-up email that you can look at to support your advocacy, and we'll be in touch with you all with more updates and other additional resources. Thank you so much. Thank you, our panelists, and we look forward to continuing the discussion. Back to you.
Thank you so much for joining, everyone. Please remember to fill out the survey, and remember, this is just the start of conversations, not the end. So we hope to keep hearing from you moving forward. Have a lovely evening.